there's many of us that will live with cancer and have to coexist with this disease. And the idea that we can give a voice and now faces to the issues behind living with metastatic breast cancer is the goal of Advocacy in Action. Elise Spatz-Kaplan is the Director of Programs and Partnerships at Living Beyond Breast Cancer. And I want to thank you again for really being a great partner to this project.
Thanks so much, Selma. It's really a pleasure to be here. This issue, metastatic breast cancer, is critically important. It's what we hear at Living Beyond Breast Cancer day in and day out. And so I think it's really timely and relevant, and I'm delighted to be part of the program.
We're going to begin with what it means to be a metastatic breast cancer patient.
Maria Wetzel is a research advocate. I've heard of Maria's name numerous times over the years I've been in the breast cancer field, so it's a delight to meet her. And Maria is also a woman living with metastatic breast cancer.
I was first diagnosed in 1996, and I was stage 2B. And from the get-go, I always felt that I wasn't finished with it. But about 9 years later, I thought, well, maybe I'll be one of the lucky ones. And then I had a chest wall recurrence, and then I started on aromatase inhibitors. The tumors have always been hormone sensitive, estrogen, very strongly estrogen positive. And I was on those for 5 years and went off them, and within a year I was diagnosed with metastatic disease, and that was about a year ago. Innumerable but small spots in my liver, don't you love that? Lungs, and actually I sought attention because I had shortness of breath. And it was not a pleasant moment when I saw the x-ray with this very large pleural effusion. So I've only been living with it for a year, but what comes to mind is that what it means to be a metastatic breast cancer patient, we have so many different groups, and there are those that are diagnosed from the beginning and those that have a late recurrence. There are those who are have hormone-sensitive tumors, and those who are either triple negative or have HER2-positive tumors. There are those that have no evidence of disease or are stable, and then there are those of us who have not found something to put us in that state yet, but we're hopeful. And then there are those that have very aggressive disease. I personally think I have a fairly indolent metastatic process, but the chemotherapies that we tried first did not do anything for it. So now I'm trying a Wetzel, which is an anti-estrogen. And I also switched oncologists at the time of my metastatic diagnosis, knowing that I needed to find an oncologist that basically I could live with for the rest of my life. Another group is a lot of women with estrogen receptor positive disease have only bone metastases, sometimes more than just bone, as Shirley did. And then there are those of us, like I do not have any bone, but I have enough visceral metastases. And then there are those that have that develop brain metastases. So you have very different groups that are treated quite differently, and their quality of life can be quite different over the course of beginning treatment and towards the end of life. So, you know, I think with bone metastases, they have to deal with a lot of pain. And I don't see that necessarily, and you can correct me with, if I'm wrong, with visceral metastases to the extent that the patients with bone metastases have this. But I happen to have moderate to severe shortness of breath. So, you know, your quality of life varies, but we share a lot in common, knowing that for most of us, our lives are not going to go the normal course of life, and that we will die quite prematurely. And there, you know, and so dealing with that aspect of it always is, it's quite different. I thought I knew a lot about metastatic disease because I've been an advocate for 16 years, and have always been interested in those living with metastases. But the reality was quite different.